Well, welcome to an update from Canada, which I've been looking forward to for quite some time. Lindsay, of course, from Friendly Pharmacy 5, who we've talked to many times before. Lots of people have been asking for you back, Lindsay, I must say. So you have been in demand.
Oh, hi, John. You've been in demand as well. My viewers have been asking about you. So it's great to be able to connect again.
Absolutely.
Now as we head into the summer.
And I think we've got good technology today. We seem to have good picture and sound, so that's excellent. So the pandemic rages on in the UK in terms of number of cases, Lindsay, and as you'll know, Europe just turned a corner. That's starting to go up. The United States cases up about 10% on the week at the moment, largely Delta variant driven. What's happening in Canada?
Well, thankfully, John, Canada, our case numbers have been steadily decreasing for weeks now. Our daily case count is hovering around 550 to 550 cases a day, which if you think back to December, we were looking at close to 10,000 cases a day at one point. So we definitely have seen an improvement as far as our case count goes. Hospitalizations are down and deaths are also down. So far in Canada, we've had a total of about 26,000 deaths recorded due to COVID-19. But it does seem in Canada that we are seeing the light at the end of the tunnel. That's largely thankful to our very high vaccination rate. So we were slow to start. If you'll remember, Canada we don't have domestic production of vaccines at this point. Hopefully we will soon. But we were very dependent on supply from other countries for the vaccines. Now we've had quite an abundance of vaccines come into the country over the last weeks. And this has allowed our population to get vaccinated at a pretty good rate. I think we're over 70% of Canadians have had one dose, and just over 30% of Canadians have had 2 doses now.
So this is coming in from the States or internationally, or where are the vaccines coming from?
Yeah, it's coming in. Some is coming in from the States, some is international. It's mostly just the mRNA vaccines at this point, so the Pfizer vaccines and the Moderna vaccines. I did hear recently they were expecting a shipment of AstraZeneca. I'm not sure where that was coming from, but that was only about 4,000 doses. And that was only to complement the series for those who've had AstraZeneca as a first dose and still wanted to get the AstraZeneca as their second dose.
Yeah. And what's public acceptance like of the vaccination? Are people queuing around the block to get it, or is there resistance, or how is it?
Yeah, I think that overall, there hasn't been too much hesitancy. Of course, we do have some people that are hesitant. We have, there's been a lot of demand, and certainly, I would say even 4 to 8 weeks ago, we could see lineups, especially in Toronto, different places where there was a higher density population. People were lining up. There were pop-up clinics that weren't necessarily really well communicated sometimes, and then people would just kind of rush to the clinics. So there's been a mix of, I think there's been a lot of enthusiasm in general for the vaccines. I don't think that there's been too much hesitancy, and that's reflected in our vaccination rates. But we did have a slow start because of the lack of supply at the beginning. And I think there's been a little bit of confusion too, John, because we did have the AstraZeneca vaccine initially, and that was launched. And then we had the cases, as you know, of the VIT, so the vaccine-induced thrombotic thrombocytopenia. And that caused Health Canada to put a pause on AstraZeneca. And they did bring it back for people over 50. And it was dependent on which province you live in, but they did prioritize the second dose of AstraZeneca for those who wanted AstraZeneca as their second dose. So that has, and also because we have had some issues with supply of mRNA vaccine, so sometimes we will have more of the Moderna vaccine available or more of the Pfizer vaccine available. Our National Advisory Committee on Immunization has been putting out some fairly frequent communications on the recommendations as they change regarding the efficacy of heterologous vaccination, so mixing the vaccines, because at this point we are seeing the Delta variant spread across the country, and they are trying to prioritize those second doses because we know that the second dose is really what protects you quite efficiently against that Delta variant.
So is there this mixing and matching, this what was it, Lindsay? Hetero what?
Yeah, this is called a heterologous vaccine.
Heterologous, yeah.
Yeah.
So that means giving one type of vaccine for the first dose, different type of vaccine for the second dose. Is that sort of official government allowed policy now in Canada?
It is allowed. Now, the National Advisory Committee on Immunization did state recently that although this can be done, we don't have studies on, say, if you got the Pfizer vaccine first and then got, say, the Moderna vaccine second. So there's a lack of studies on that. But based on the immunology and what we understand about vaccines, it should be okay for you to do that. However, if the second dose is available and if it's the same as your first dose, then that's preferable. So, even me explaining that was a little bit complicated. So you can imagine how the public is receiving this, especially just after AstraZeneca was scaled back and people were told, okay, well, you can get an mRNA after your AstraZeneca. I think it's been a lot of difficult communication. Maybe it's not been received incredibly well by the public. I think it's been a lot to ask the public to try to understand all of this. But our vaccination rates do continue to increase, and now a lot of Canadians are getting their second doses. So, yeah.
I mean, in theory, I think we've always known there shouldn't be a problem giving a different vaccine. It's just an antigenic stimulus, isn't it? I mean, and of course, the irony is that if people don't have an adverse reaction, these very rare adverse reactions after the first AstraZeneca vaccine. It's very less likely they'll get it after, massively less likely they'll get one after the second, and yet, so it has been not always based on the science, not always based on the epidemiology. There's been a sort of an emotional component and an acceptance, I would think.
Yeah,
that's affected this.
I think I was speaking with someone the other day, and just the mixing and matching of vaccines maybe goes against a little bit of our Canadian culture. Maybe we like things by the book. If we are told at the beginning to get 2 doses of the same vaccine, why in 4 to 8 weeks are you telling us, oh, now this has changed? Well, the science has changed, and then also, availability has changed, the pandemic has changed. It's very hard to understand that and explain that in a way that everyone is going to understand. We do mix vaccines. We have mixed vaccines before. So like the hepatitis A vaccine, different vaccines, we do this, but we don't usually say like, well, this is a different manufacturer.
No, you just say,
it's irrelevant. The vaccine does not stay in your body. The vaccine disintegrates within a couple of weeks. You cannot even detect it, right? So, but when you present this to the public, I mean, they want to make an informed choice. So I understand that people might be a little bit confused or kind of a little bit unsure of, okay, what exactly is going on here?
Yeah, I think the initial messages are probably the ones that are received loudest. And, I think maybe governments weren't as careful as they could have been about how the initial messaging was getting through. So that's maybe a lesson for next time. What about social compliance in Canada, Lindsay? People still wearing masks, social distancing, ventilating?
I think that people are doing their best in general. They are tired, and we are seeing some mask mandates being lifted in different parts of the country. So in my province of British Columbia, our mask mandate, so masks in all public places, was lifted on Canada Day. So that was July 1st. It's still recommended that you wear a mask if you have not been fully vaccinated, and some businesses are still asking people to wear a mask. For example, in pharmacies, we have a lot of people coming into pharmacies that are immune compromised, right? So it is important that people continue to wear a mask if they haven't been fully vaccinated. But I mean, here's just a very simple example. At the grocery store, we have arrows on the floor that tell us when we're going up a certain aisle, this is the direction you walk in, and I noticed last week, I think all of this great news about the vaccines and about cases dropping, people are starting to feel a lot safer and a lot more comfortable. So I noticed for myself, social distancing is dropping off. People are walking where they want in many of the aisles. And I think people are getting a little bit lazy, but also, I mean, we are seeing community spread go down, but I don't think it's time to let our guard down just yet. We do have this Delta variant spreading, and so it is something that, even though we're tired, and it's also summer, people just want to enjoy their summer. It's been very hot.
Sure. Yeah.
So there's a few different factors there that are present.
I've become like really conscious of my social space.
Yeah.
You know, if someone in the supermarket's a bit closer, going, you know, what are you playing at? You know, it's as if someone was like, you know, in the everything's been sort of the norm has been readjusted, which of course is interesting how quickly that's happened.
Yeah, for some people, and then there's other people who just have no clue, and it's almost like where you've been for the last 15 months. Yeah.
But I think most people have. I think there's been a genuine cultural shift. I think it wasn't there at the beginning.
No.
You know, people were standing just that far behind you at the beginning, but now it's not common. Not common at all. Now, you mentioned variants there, Lindsay. What's happening?
Yeah, so we do have the 4 main variants in Canada. So the B117 variant, I guess that's the alpha variant now, with the new nomenclature, has become dominant across Canada. We also have the variant that originated in Brazil. I think that's the gamma variant, the P1 variant, that was very prominent in British Columbia. But the Delta variant is causing some concern in Canada. To date, we have 4,100 cases of the Delta variant in Canada. It seems to be predominantly right now in Ontario, specifically in Toronto. Toronto has quite a bit of that variant.
So this is way east, isn't it? It's a long way from you.
It is far from me. Yeah, this is more like central Canada. And British Columbia, my province, we also have a good amount of this Delta variant. And a few months ago, I think that was the last time I was on your channel, John, I did report that I was concerned because we did have people traveling from India who were on planes and they were already sick. And so I'm not surprised that variant has taken up residence in British Columbia. We do still have the gamma variant, the P1 variant in British Columbia, although it's not taken off like I kind of was concerned that it might. So that is what is happening with the variant. So the Delta variant has been identified in all 10 provinces and 1 territory at this point. But like I said, it is predominantly in Ontario and British Columbia at this point, but also scattered throughout the country.
But based on what's happened in other countries, and you've got 4,100 definite cases so far, it seems to me pretty inevitable that the Delta variant is going to become the predominant variant in Canada.
And I would suspect that there could be a lag in reporting on those cases because the epidemiologic report from this week, they actually haven't even graphed it yet, and it's not in the table for the stats by province. So I would suspect that may be a lower number than the actual reality.
So even though cases have been coming down in Canada nicely, as they had in the States, this Delta variant, I think, as it's doing in the States now, will inevitably cause an increase in cases, hopefully detached from sickness and hospitalization because of the vaccines.
That's what
But is that kind of the anticipation in Canada, that there could well be an increase in cases because of the Delta variant?
That's definitely a concern, and that is why there has been such an emphasis, especially recently, on different areas to get vaccinated. They're really trying to stay ahead of the variant. So we understand the epidemiology of this variant. We understand that this variant will likely become dominant. Also, there is a pressure to open the border to more travel. And they're hoping not, it sounds like they're not going to do that until maybe 75% of the population is fully vaccinated. But once that happens, I mean, obviously there is travel already. Once that happens, the spread of the variants is just that much more. So having as many people protected with second doses is, I think, the strategy that is happening right now.
I'm optimistic about that. My concern is for people that are immunocompromised who've been singly or doubly vaccinated but have not generated immune response. These people are probably going to have to carry on guarding until herd immunity is well established. I'm not sure that message is getting through loudly enough in quite a few places, but I think that is unfortunately going to be necessary.
It's something that definitely concerns me with, say, the mask mandates lifting, and different things, public health measures that are becoming relaxed. I think that people need to understand that not everyone is going to have this 94, 95% efficacy.
Yeah.
And some people, there is talk in Canada of some people who are immune compromised or have autoimmune diseases needing a booster in the fall. That is happening. That conversation is happening anyways. I think that people are very excited to get rid of masks and to move on. But I also think it's important that we understand that everyone has a different level of risk and will have a different response to the vaccine. And we need community transmission to be quite low, and we need the vaccination rate, fully vaccinated, to be extremely high. They're saying maybe over 90% for there to be adequate herd protection, right? So,
well, with the Delta variant, I think that's true, because obviously the more contagious the variant, the higher the percentage needs to be to establish that kind of immunity. So, I mean, it still is that certain people's health does depend on everyone else, and
definitely,
I think that there's the scope for kindness and consideration here, as well as the freedom that everyone's craving for, and it's that balance there, isn't it? Now, I've been hearing about the Saugeen people in Canada. Don't know any more than that, really. I've just heard about it. Well, are you up to speed on that story?
Yes, I've heard about the Saugeen First Nation. This First Nation community, they live on the Saugeen River of Lake Huron. So that's one of our Great Lakes in Ontario. And they're having quite an outbreak with the Delta variant. This is a bit surprising because very early on in our vaccination campaign, all of the First Nations communities, or my understanding was all of these communities had been reached out to, and most of them had been vaccinated at very high rates of vaccination. So it sounds like this First Nation community might not have very high rates of vaccination. And what happened is, in this Grey Bruce area, so this region of Ontario, the Delta variant started spreading. It sounds like it was among homeless people, people who are transient, and eventually it got into the First Nations community. This is a smaller community of about 1,700 people, but we know how fast this variant spreads. So I was just looking at the statistics. So on this past Sunday, they had 27 cases in their community. The next day they had 6 more, and now they're reporting about 74 cases and 4 to 5 hospitalizations. So there is a vaccination campaign that happened there yesterday. They are all on a lockdown order in that community. The Saugeen First Nation has asked their community to isolate, stay home, and they did a drive-through vaccination clinic for people who have not been vaccinated. So I do hope that they will get through this without, too many fatalities or severe disease. They have asked the Red Cross to come in and help, and I know that there have been volunteers going in to help with food, and they're setting up a field hospital there as well, so these people can isolate and get treatment safely. So that's it just shows that there are still communities that are very vulnerable to these variants.
And of course, vaccinating yesterday is too late.
Yeah.
It's we've got 3 weeks after the first dose, and then, and of course, the new data now is that for most vaccines, it seems that 8 weeks between doses is much better. You get a higher response than the 3 or 4 weeks after. So they just can't be rushed. So if you have one vaccine now, another one in 8 weeks, and good immunity 3 weeks after that, we're looking 3 months really.
Yeah.
Down the line.
And this goes into there's a lot of people that might still be waiting for their vaccine. And it does concern me, because when we get into the fall, if you decide to have your vaccine in, say, October or something like that, it is quite a lengthy time until you are fully protected, right?
Yeah.
So, maybe we might see flu again this year. I don't know. Likely, if we're relaxing public health measures, right? So I do hope that the First Nations community there will be able to get through this, isolate effectively, and hopefully their vaccination rates go up so they don't have to go through this again.
Yeah, and there's a lot of comorbidities, unfortunately, in First Nation groups in Canada as well. I mean, what sort of comorbidities do they often have to live with?
Yeah, we do have high rates of diabetes, definitely in First Nations communities. They are more prone to diabetes, sometimes obesity, even malnutrition, so vitamin D deficiency, actually, John, in some of the communities. We do see that as well. Now, that isn't necessarily because of a lack of, say, sunshine or something like that, but poverty just in general. People are the different societal reasons for that. Do affect these people. Now, John, it's interesting you mentioned that, because I just, as a Canadian, I would like to talk a little bit about the tragedy that that unfolded and has been unfolding for decades in Canada. And this is referring to Canada's residential school system. So for those who don't know, these residential schools started, I think, just after 1880. And our first Prime Minister, Sir John A. Macdonald, was actually part of this as well. And I love Canada. I love my country, but I do think that learning about the history is important. And Canada is going through a little bit of a state of mourning right now, right across the country, for people who were, what basically happened is many First Nations children were taken from their homes, children as young as 3 years old, taken from their parents, and they were put into these residential schools that were run by the Catholic Church and the Protestant Church. And essentially what they were trying to do is there is a quote where they said they were trying to take the Indian out of the child. They were trying to make them more like the European culture. And it's really been terrible to learn. I've only learned this over the past 10 to 15 years, but we've really come to a head here in Canada. As recently, they've been discovering the unmarked graves of children that actually died in these schools, and there were many factors that caused these deaths. So there was abuse, there was neglect, there was malnutrition. It's just horrific if you hear about these stories. And so this is something that it's great that COVID-19 is kind of dissipating slowly. Our vaccination is going well, but Canada is also very much in a state of mourning, and just the tragedies, and also not just the children, but the families, the generations that have been affected by our residential school system. The last residential school closed in 1996, John. So this is something that is fairly recent, and it's something that is definitely worth learning about. And it's something that's very heavy on my heart these days, for sure.
No, I understand that completely. And has this got implications for ongoing health problems today, Lindsay, do you think?
Oh, definitely. We see, like I said, diabetes. We also see even alcoholism, malnutrition. I mean, some of these children that survive these residential schools, they did not receive love. They did not receive care. They don't know how to care for themselves. So how are they going to care for their children, right? Yeah. And so that
can go on to the next generation.
Exactly. And we do see poverty, and it's really a very complex situation, and it's something that I'm definitely trying to learn more about. I hope to interview someone about this on my channel in the future, because even just the malnutrition, I mean, they did research on these kids in regards to if we deprive them of different nutrients, how will they react? I mean, it's just horrific if you learn that this is part of our history.
I mean, this human experimentation thing reminds you of various vile groups in the past, doesn't it? We won't talk about, but yeah. So. No, I mean, I'm just feeling that sort of. I can feel the emotion from these 6,000 miles away, or whatever we are apart. Just how can people get it so wrong? How can it's just you just can't compute that somehow, that this could have happened in fairly modern times. It has to be said, within the scientific era. And then, of course, the other thing that people often forget about First Nation groups is. Almost certainly in the 15 and 1600s, 300 million people died in the Americas from smallpox.
Yes. Yeah.
So when the Europeans actually arrived, when we started making Western movers in the 1820s or whenever it was, most of the First Nation groups had already died in the 100 years before from smallpox. In numbers which are quite unconscionable, with death rates that could well have been 90%. It's if you'd kind of try and put yourself in a situation where, you live in a community and over a decade or so, 90% of the people die. It's just, it's just unbelievable. Yeah. And the implications for today and things to learn from that. I agree completely. You know, maybe the key thing is humility, you know, consider it possible that we could be wrong.
Yeah, I think
learning from other cultures.
Yeah, humility, looking to learn and understand why we see some of the issues that we see nowadays in the Indigenous communities, seeing how we can help, right? As you know, what kind of help is needed. I mean, First Nations communities have been reaching out for years and years, saying, you know, we need this, we need that. This is what's gone on. But I think that learning about our history is definitely a way to step forward, a way to prevent these kinds of atrocities from happening in the future. And so this is a part of our history, but it doesn't have to be a part of our future.
No, absolutely. And this is what happens, of course, whenever you get totalitarianism, the first thing they often do is rewrite the history books. You know, this history has changed, or parts of history are exaggerated, parts of history are ignored.
Yeah.
And this balanced view of history is just so important to who we are today. You know, history is not some academic subject that you do for an O-level in school then forget about. You know, it's it's something that we actually live with. And you know, particular groups that exaggerate particular aspects of history for their own purposes.
Yeah.
Or as has happened with this First Nation example, particular groups, say 1950s Canadian governments, you know, basically ignoring this aspect of history. And you know, but both are probably equally bad, and we need that balance so that we learn from history. And as you beautifully said there, it doesn't have to be part of our future.
That's right. That's right.
Lindsay, fascinating insight into current Canadian culture, which to me is very, very interesting. Along with that excellent update on COVID-19, which I must say, the way things are going, I was talking to PJ from Ireland this morning, and I used the term cautiously optimistic.
Yeah.
So I think I'm going to give Canada a cautiously optimistic. Okay.
I would gladly accept.
Yeah. So that's a blue tick, not a red tick, but it's
okay. We'll take it.
But I really think we are. I think we are in the last throes of this pandemic. I really think we are. I think things will be a lot better this time next year, but it's not going to go away entirely. There's going to be a residue, and yeah, I think I maybe just mention just before we finish. You were talking about other viruses. So last year there was essentially no influenza in the world.
That's right.
Compared to what we normally have.
Yeah.
A lot of types of influenza, the immunity is relatively short-lived. So there could be a lot of influenza. There could be. And the other thing we've got at the moment in A&E departments, especially in children in the UK, I don't know what it's like in Canada, but we've got loads of kids coming in with respiratory syncytial virus. You know, the common virus that kids get, you know, and you know, because, you know, a lot of kids haven't been exposed to this for a year, 18 months, and now all of a sudden they're going back to the toddlers groups, and of course it's spreading. Most of the children aren't unwell, but they get a fever, and of course fever, as you know only too well, parents find alarming.
Yes.
Even though in itself it's not necessarily a red flag, and you know, parents need a lot of reassurance on that front, and that's of course that's a very big demand for healthcare provision, which is currently happening. So these are these endemic viruses which we could be seeing more of this winter.
Yes, and I think that also the factor that children under 12 are not vaccinated in Canada. So I do think we are going to see more of these colds and flus, different viruses in children as restrictions are lifted. And the question will be, is this COVID or is this something else? So I do think it's going to be a little bit of it's going to be gradual. It's going to be a bit of a learning process in the fall, but definitely, I think you've spoken about the uncoupling of the severity of the disease versus the cases, and so I think that is definitely something that I'm looking forward to, and I think there's already evidence of that.
You know, hopefully in a year's time we'll be saying, no, probably just a bit of COVID. You know, it'll become like just a bit of COVID, nothing to, you know, it'll become less. Hopefully that's
You think that's what will happen?
I'm hoping so, yeah.
Yeah, I had a viewer ask me, what does John think is going to happen moving forward? Is this going to just become like the common cold?
As more and more people get vaccinated, I believe that's true. Now, you and me, we're in the fortunate minority in the world at the moment. We've had 2 vaccines. Yeah. So if I'm exposed, I'm okay. I could get ill, but it's remarkably unlikely. You're even less likely to get ill than I am, and because you're younger and female. But if I was infected now, then it's almost certainly it could be asymptomatic, minimally symptomatic, headache, runny nose, sore throat, sneezing are the most common features now in the doubly vaccinated. But of course, if I was exposed now, that would be a very nice booster. Thank you very much.
Yes, that's a good way to think about it.
That would really boost my immune system. So as these become perhaps more endemic, as we are seeing with the Delta variant now, it could paradoxically work out to be a good thing because it's naturally infecting people with minimal infection who've been vaccinated. Therefore, it's just like giving them a booster shot every few weeks. And that wasn't a well thought out series of comments there, but I think that could well be the way that it's going. That it becomes certainly we can say it's going to become much less serious as immunity increases. We can say that for sure.
I agree. Yeah.
Lindsay, thank you very much. And I believe we're going to chat about the weather on the next video, but leave that there. So thank you for that, Lindsay.
Thank you, John. Take care.
You too.